Hello, I'm Nurse Robert, and today I'm going to be conducting a head-to-toe assessment of my patient here. At this point, I've already obtained a health history from my patient, noting any pertinent data for the purposes of my head-to-toe assessment. I've provided for patient privacy and confidentiality, and the patient knows that they have the right to refuse treatment here at the hospital. I've closed the door again once again for providing for patient privacy, and I begin by greeting the patient. Hello, Mrs. Sanderson. How are we doing today?
I'm doing very well, thank you.
Okay. Do you know where you are?
I'm at the hospital.
You're at the hospital. Can you tell me why you're at the hospital today?
Yeah, I was having some pain. I was painting.
Okay. You're painting. Okay. And can you tell me who the President of the United States is?
That would be Donald Trump.
Okay. And what's today's date?
I am unsure.
Okay. Well, it's November 14th.
Okay,
but
yes.
We've established that the patient is in fact alert and oriented ×4. She works nights, so we're going to excuse the fact that she did not know immediately what day it was. And I begin my head-to-toe assessment by inspecting the skin of the face, and I'm noting that her coloration is in fact appropriate for her ethnicity. I would note any areas of erythema or any swelling or anything like that. And I'm going to proceed to inspect and palpate the scalp and cranium, looking for any lesions or lumps or any areas of tenderness. Can you tell me, is this tender at all? Does this hurt?
That's fine.
Okay. All right. And I'm going to, at this point, I would have already, having had a conversation with her, I would have already inspected her facial expressions for symmetry. And they are, in fact, symmetrical. And I'm going to move on to palpating her temporal arteries bilaterally. And I notice that she does have a pulse bilaterally in her temples. All right. And I'm going to go, and I've already palpated, so I'm going to go ahead and palpate the temporomandibular joints, having her open and close her mouth. Can you open and close your mouth for me? All right. And I'm noting any grating or clicking sounds. Okay. Next, I'm going to assess the function of cranial nerve number 5 by having her clench her teeth. Can you clench your teeth for me? And I'm feeling the muscles right over here, making sure that they're contracting. Okay, you can relax. All right, now go ahead and try to open your mouth. And I'm assessing the strength of the muscle here. Again, the function of cranial nerve 5 by having her open her mouth against resistance. Now, I'm also going to test motor function of the face. And this assesses the function of cranial nerve number 7. And I'm going to have the patient do a series of things with her face, make a series of expressions, and make sure that that the cranial nerve number 7 is functioning. Okay, Miss Sanderson, can I have you smile for me? Thank you. Can you frown? All right. Can you close your eyes tight for me? Thank you. And can you lift your eyebrows? Thank you. Can you show your teeth? Thank you. And now puff your cheeks for me if you can. Thank you. And again, I'm observing for the symmetry of these expressions and making sure that there's no droopage on any one side. You can let that out now. Thank you. Now we move on to the eyes, and at this point, I'm going to assess her visual acuity by making use of the Snellen chart, and I'm going to have her stand at a line 10 feet from my Snellen chart. So, Mrs. Sanderson,
Yes.
could we walk over here?
Sure.
And this is also a good opportunity to assess a patient's gait when you see them walking into the Snellen chart, depending upon how far it is. All right, at this point, Mrs. Sanderson, could you cover your left eye
Left, okay.
with that index card? And I want you to read the smallest line on that chart that you can see clearly.
PECFD.
All right.
PECFD.
All right, thank you. Now if you could cover your other eye, and again read the smallest line that you can see.
EDFCZP.
Thank you. She read line 5 with her right eye, and she read line 6 with her left. All right. Once again, can I get you to come on back to the bed here? And again, that assesses the function of cranial nerve number 2. Next, I'm going to assess the function of cranial nerves 3, 4, and 6 by assessing her extraocular movements, and I do this by assessing how she follows the end of this pen light through 6 fields of vision. All right, can I get you to focus on the edge of this pen light, please?
Okay.
All right. Thank you. And I had her follow this without moving her head, just following this with her eyes. Now I'm going to further assess the function of cranial nerves 3, 4, and 6 by seeing that her pupils are reactive to light. All right. I'm going to shine this in your eyes. I'm just going to come up from the side here, and I'm just going to see if your pupils constrict. And it does. Now for the next. All right, I'm noticing that her pupils do react to light, meaning that they do constrict when the light is shown into them. All right, and now I'm going to assess the function of cranial nerve number 3 by testing for accommodation. She's going to follow the edge of this light with her eyes to the tip of her nose. All right, can I get you to focus on the end of this light, please? All right. And in normal findings, the eyes should cross as the object moves closer to the nose. All right. And then I'm going to move on to inspecting and palpating the structures of the eye and around the eye. I'm noting that her eyebrows are beautifully sculpted. She has a good esthetician. And I'm just looking at the eye. I'm also inspecting the whites of her eye to ensure that they're not yellow. If they're yellow, that would indicate possible jaundice. I'm also inspecting the conjunctiva in both eyes, and they're pink and moist bilaterally. And I'm also palpating around the eyes for any tenderness. Does this feel tender at all? Does it hurt?
No.
All right. Thank you. And I'm also inspecting the irises, and they look normal and healthy. All right. Now I'm moving on to the ears, and I'm going to inspect both her ears, and I'm not noting any swelling at all. I'm going to go ahead and palpate them. Does this hurt at all?
No.
All right. I'm going to move on to the other ear, palpating it as well for any tenderness and looking for any lesions or damage to the ear, and I'm not seeing any. All right. And now I'm going to test the function of cranial nerve number 8 with the whisper test, meaning I'm going to occlude one ear and whisper something in the other ear, and she will repeat the word that I say. Okay? I'm going to whisper a word. I'm going to cover one ear, and I want you to repeat the word I say. Okay?
Okay. Huh? Fried chicken.
Thank you.
Honda Accord.
All right. Thank you. Now we're going to move on to the inspection and palpation of the external nose. And I note that the nose is symmetrical. I'm inspecting it on both sides. I notice that the nares, they're flaring right now. And I'm going to go ahead and palpate it and ask you, are you feeling any tenderness here?
No.
And I'm also noting the coloration of the nose. This can sometimes be an indication of different health problems. For example, like a large reddened nose can indicate this. You commonly see this in alcoholics, people who consume too much alcohol. But obviously we see that her nose color is appropriate to her ethnicity, so we don't play that. All right. Now I'm going to test the patency of both nostrils by what we call the sniff test. I'm going to block one nostril, and I'm going to hold a cotton ball, a scented cotton ball, up to her nose, and she's going to tell me what she sees, asking the patient smells.
Oh,
Wrong scent.
smells. All right. I see, said the blind man.
Nice. But you're not blind. We already established that with the Snellen.
Yes.
With the Snellen chart. Okay. So I want you to close your eyes for me. Thank you. I'm going to close one nostril.
Mm-hmm.
Can you tell me what you smell?
Coffee.
All right. Thank you. Move on to the other nostril.
Lemon.
Nicely done. So we've established that both nostrils are patent. We continue with our assessment of the nose by palpating both the sinuses. We're going to palpate the sinus here. This is the maxillary sinuses, and we're going to ask, do you have any tenderness here?
No.
How about? And these are the frontal sinuses. Any tenderness?
No.
Okay. Now, if the patient does have like seasonal allergies, there could be some irritation or tenderness there, but we would have already noted that again, having taken her history prior to this exam. Next, we move on to our inspection of the mouth and throat. And for that, we're going to use our pen light, and we're going to look at the buccal mucosa. All right, can I get you to open your mouth for me? All right, and I can see that the buccal mucosa is it's moist and pink. It looks very healthy. And get you to stick your tongue out for me. All right, we see that she has the inherited trait where she can roll her tongue. Nicely done. And we're also taking this opportunity to inspect both the teeth and the gums. And it looks like her dental hygiene is well maintained. Okay, and at that point I was also inspecting the palate, the pharynx, as well as the uvula. If the tonsils are present, we're going to assess and grade them as well. But I know, having taken this patient's history, that she has had hers removed at the age of 8. Okay, and now we assess the cranial nerves 9 and 10, in which we note the mobility of the uvula as the patient says, as the patient vocalizes. All right, and we're also going to check the gag reflex. All right, can I get you to open your mouth and say ah?
Ah.
All right.
Ah.
I note that the uvula does move up and down when she says ah. Thank you.
Ah.
All right. Thank you. And we're going to check the function of cranial nerve number 12, noting the symmetry and function as the patient sticks out her tongue. Can you stick out your tongue and move it from side to side for me? Side to side. There you go. And you move it up and down. All right. We see that cranial nerve number 12 is intact. Thank you much. Now we move on to the neck. And we're going to begin our assessment of the neck by palpating her lymph nodes. We palpate the preauricular lymph nodes, as well as the postauricular.
Bless you.
Oh, thank you. And moving on to the occipital, submandibular, as well as the tonsillar, and the posterior cervical. We're also palpating the superficial cervical and the deep cervical chain, as well as the supraclaviculars. And I note with this patient that the lymph nodes are not palpable. If they were, it could indicate the possible presence of infection. All right, moving on with our assessment of the neck, we are assessing the function of cranial nerve number 11 by assessing the mobility of the neck. All right, at this point, Mrs. Sanderson, could you bend your head forward and touch your chin to your chest if you can? Thank you, nicely done. And can you turn your head side to side for me? Thank you. And can you touch your ears to your shoulders? Just one at a time. It'd be pretty amazing if you do it both at the same time, but we're not worried about that today. Can you tilt your head backwards as far as you can? All right, thank you. And I'm going to apply resistance and see if she can turn her head against the resistance of my hand. Can you turn your head now? Thank you. All right, thank you. And can you shrug your shoulders against resistance? Thank you. All right. And now we're going to palpate the trachea. We've also inspected the trachea, and I don't notice any deviations when the patient breathes. We're going to palpate the thyroid. Can I have you swallow for me? Okay. I note that this patient's thyroid is not symmetrical, but I know from her history that she's had a surgery on her thyroid. Isn't that right, Mrs. Sanderson?
That's correct.
She's had thyroid surgery some years ago. Okay, and now we're moving on to the inspection and palpation of carotid pulse on both sides. And I note that it's present on the left side, as well on the right side. And I use my stethoscope because I'm going to listen for any bruits that can indicate that there is obstruction to these pulses. And I note there are no bruits. Okay. At this point, we're moving on to my inspection of the chest, the posterior and lateral, as well as ventral. Okay. So first we're going to go behind the patient. You can trust me. And I'm going to inspect and palpate. I'm also checking for the tactile fremitus. And I'm looking for symmetry of lung functions. I'm going to have the patient take a deep breath for me, please. All right. And I notice that this does separate my thumbs. Both hands are moving, so there is symmetry. I'm also going to percuss all the posterior lung fields. And I'm also going to percuss the costal vertebral angle to see if there's any tenderness present. Does this hurt at all, Mrs. Sanderson?
No, it doesn't hurt.
Okay. Now we move on to listening to the breath sounds, and I'm going to do this on both sides. All right. Mrs. Sanderson, I'm going to ask you to take a series of deep breaths for me, okay?
Sure.
All right, deep breath in. Thank you. Deep breath in. Deep breath in. All right. I noted that her lung sounds are present bilaterally, and they're equal. I'm noticing no crackles or rales or rhonchi, that she's breathing normally. And I'm going to go ahead and auscultate on the ventral aspect. All right, deep breath. Thank you. All right. At this point, I'm going to go ahead and move on to the inspection of her upper extremities. And I'm inspecting and palpating both arms and noting any tenderness. Does this hurt at all?
No, there's no
Okay.
pain.
I'm not noting any lesions or any swelling, anything like that. No pain at all.
No, no pain.
Okay. We're going to move on to the function later, but I'm also going to palpate her radial, brachial, and ulnar pulses in both arms. This is her radial pulse. I note it's present. Okay. And I'm not using the thumb, my thumb, because there is a pulse in my thumb. All right, thank you. All right. And I'm also assessing her capillary refill in both hands.
Yeah,
And she likes her nail polish, so it's going to be a little more challenging with
the
this.
kids
particular
did that.
patient.
I didn't do that one.
Her lovely kids did that. And I note that it's within 3 seconds on this side. As well as 3 seconds on this side. All right. Now we're testing the range of motions of her shoulders. So what I'm going to do is I'm going to have you flex your arm like this, just over your head.
Okay.
Can you do that?
Flex like that.
Yes, ma'am.
Okay.
All right. Can I have you do it with your other arm, please?
Sure. I did put on deodorant. That's good.
Well, we're always appreciative of that. Not all patients do.
Can I stop now?
Yes, you can.
Okay. Okay.
All right. Now, if you can hyperextend, and that means put your arms, interlock
Okay.
your fingers, and extend your arms behind your back.
Interlock my fingers and then extend my arms behind my back.
Interlock your fingers.
Oh, behind
Yeah,
me.
extend it behind your back with your
Oh.
fingers interlocked.
Okay.
All right. Thank
All
you.
right.
All right. Now, can I get you to stand up? And I want you to spread your arms like this
Okay.
and put your arms down. I'm having her abduct and adduct her arms and noting that she has normal range of motion in those upper extremities. You can go ahead and have a seat now. All right. And now I'm going to have her flex her check the range of motion in her elbows. Can you lift her arms for me and flex your elbows like this?
Okay. Like this.
Thank you. Did you notice any tenderness or did that hurt at all?
No.
Okay. All right. Can I get you to put those down? All right. Thank you. All right. Now I'm going to have you do this for me. Can you do that with both?
It's like Simon says.
Yeah, that's what we call the supinated and pronated.
Okay.
Thank you. All right. Now we're going to have you extend your elbows against resistance. So hold up your arms like this
Okay.
for me. I want you to push against me. Thank you. All right. Now I'm going to have
Okay.
you do that again. Not quite all the way folded and push and pull against me. Pull against me. All right. We know that this patient is stronger than the average patient. Now we're going to check the range of motion of the wrist, hands, fingers. And okay, can I get you to hold up your hands for me?
Sure.
And just turn them like this. I'm going to have you flex your wrists. Thank you. Have you extend them like this. All right. Can I get you to hold your fingers flat and flex them? Sorry. And spread them. And extend them, excuse me. Now can you spread them flat? Okay. Now can you make fists for me? Okay. Now I'm going to have you do this for me. Can you touch each finger to your thumb?
Okay.
All right. Thank you. And this also tests cerebellar function. And now I'm going to have her move her do the finger to nose test. So I want you to touch my finger and then touch your nose. We're going to do this first with
Okay.
your right hand and then
All
your
right.
left. Okay. Thank you. Now can you do it with your left hand? All right. Thank you. I note that that's a normal finding. And now we're going to test for graphesthesia and stereognosis. So I'm going to have the patient close her eyes. So would you close your eyes for me? And I'm going to trace a letter on her palm, and she's going to tell me which letter I've traced.
C.
Nicely done. All right, and I'm going to place an object. Well, actually, I'm going to test her other hand first.
A.
Thank you. All right. Now I'm going to place an object in one of her hands, and she's going to tell me what the object is if she recognizes it.
Wait. Oh, just one hand?
Mm-hmm.
It has wheels. Probably a car.
Nicely done. She knows that this is a car. You can open your eyes for me if you'd like. All right. Now we're going to test her biceps, or excuse me, her reflexes, and we're going to start with the bicep. Okay.
Not sure.
I'm sorry, with the brachial. Excuse me. Let's see. Okay. All right. Notice present there.
What is it supposed to do?
This is the tricep reflex.
It's my funny bone. Okay.
See? Alright. Now that we've tested the reflexes, we're going to move on to the anterior chest with the patient lying. Alright, can I have you lie down for me, Mrs. Sanderson?
I'd be more than happy to lie down.
Okay. And now I'm going to go ahead and inspect the anterior chest. Again, maintaining patient privacy. Okay. And again, I'm inspecting the work if she's using any accessory muscles while she's breathing. I note that she isn't. And I'm also going to go ahead and auscultate her heart. Okay. Now I've done all of that with the diaphragm of my stethoscope. I've auscultated her at the aortic, pulmonic, tricuspid, and mitral areas with the diaphragm of my stethoscope, and now I'm going to go ahead and do that as well with the bell. Okay. Okay, now I'm going to move on to my inspection of her abdomen. So to do that, I'm going to lift her shirt up again, maintaining patient privacy. The curtain's drawn, the door is closed. Okay, and I'm looking for contour and symmetry and noting any
have
variations in color.
Umbilical hernia there.
Yeah, I'm noting that the contour would indicate that she does have an umbilical hernia. That's another thing I'm checking, the umbilicus for hernias. And I'm going to go ahead and listen to her. I'm listening first because it's the abdomen, and to her bowel sounds in all four quadrants. All right, I'm noticing that she does have, that her bowel sounds are present and active in all 4 quadrants. Next, we're going to auscultate the aorta, the abdominal aorta, and as well as the renal arteries.